This is a podcast overview for the objectives on Chapter 12, Managing and Controlling Clinical Pain. So the first part of the chapter will start out talking about chronic pain as a syndrome and how it is very different from acute pain. So some specifics about that. And then we'll start to get into the various medical treatments for pain, looking at specifically how effective these are, how they're delivered, and then what are the outcomes for patients in terms of pain relief when going these different routes. We'll also talk about the importance of the collaborative effort amongst healthcare professionals for treating pain. Pain management, pain treatment is very entwined into the delivery of care that patients get, and it requires a lot of communication across multiple different healthcare professionals who might be treating that patient. We'll also look at the operant approach to treating pain. This deals with operant conditioning, learning approach to pain, and this is largely explored here because a lot of our pain perception, as we saw in the last chapter, is subjective. And a lot of our pain experiences teach us how to respond to pain and how to work through it and manage it. So a lot of how we deal with pain is very learned in its pattern. And so things like classical conditioning and operant conditioning can have a real effect on how we treat pain. We'll also look at fear reduction, relaxation, and biofeedback as tactics for pain relief, as well as cognitive methods for pain management. So this really deals with how people think about their pain, and how we think about pain can trigger then how we respond to pain, the behavioral aspect of pain management. And so we'll be taking a look at this in terms of, what is most effective. And a lot of times it's a combination of cognitive and also, operant approaches, as well as meds, as well as other behavioral approaches like relaxation or biofeedback. We'll take a look at hypnosis and interpersonal therapy, which have been newer sorts of treatments for pain, which very much so hinge on a patient's level of suggestibility. So these do not work for everyone, but can be successful for some. Looking to explain also what is involved in stimulation therapies for pain. Stimulation therapies are things like acupuncture or acupressure, TENS units that basically detract from pain by drawing the muscle attention elsewhere, or the nerve sensation and nerve stimulation elsewhere, drawing it away from the pain, the source of the pain, into somewhere else. So these can be effective as well. And then lastly, we'll look at physical therapy for pain management, very much so for recovery and recuperation from surgeries, but also for chronic pain as well. And then the role of pain clinics, which have become much more widely used, this being because we now approach pain from a multidisciplinary sort of viewpoint, in that the management of pain is often kind of the fine-tuning of many different doctors and different specialists that come into play to try to deliver as an effective treatment as possible for the patient. And this could be, coming from many different avenues or many different areas in order to achieve that. And that will conclude Chapter 12, Managing and Controlling Clinical Pain.